Dr. Rocco decided to go and get his doctorate in chiropractic to learn to use the latest health research, new technology tools, and the most advanced medical tools to restore functioning and health for people. Doc Rock, as he's called, moved to San Francisco Bay Area and attended chiropractic college during his second year. Unfortunately, he was hit by a car on the way to school that resulted in conditions that changed his life and such forever, such as digestion dysfunctions, neuropathy in his spine and arm, and detached retinas. He took the typical conventional medical route of care that only offered symptom management. Doc Rock eventually had to undergo 10 retinal detachment surgeries that proved to be unsuccessful.
She introduced me to the LifeWave patches, which at first I was curious because being in the field that I'm in, holistic care, you got to be open-minded. This concept, these patches can help to stimulate stem cells and peptides. This is pretty interesting. Okay. I had already been in the field of regenerative medicine. I had already been using stem cell therapy in my clinic back in Colorado for injuries. People come in to get some stem cells to help them with the injured knee, injured shoulder. Really good results. But I'd probably say 50-50. Probably take them 3 to 6 months to see changes. And most people, they have a hard time with that because they're impatient. They're suffering. They're struggling. They don't want to wait. They want instant results. So other people also kind of shy away from regenerative medicine and stem cell therapy because they're like, there's needles. Wait, I got to do injections? You got to do an IV. So the whole idea about needles kind of makes, I'd probably say about 30% of the people not do it. And so that's very understandable. So because of that, I had already been familiar with regenerative therapies. And on top of that, I had already been researching and implementing ways of using peptides in my clinic to help people with similar things of regenerative healing and decreasing inflammation or addressing chronic illnesses. Unfortunately, peptides, which are a building block of proteins, if we have some beef or chicken or fish and we digest that protein, we break it down. We make about 300,000 different peptides that help our body to boost and accelerate functions. Maybe something as simple as increasing our circulation, maybe regenerating and producing new white blood cells, or helping us to increase the metabolic rate of cells. So if we're losing weight or building muscle, simple things like that. They can also help us to regenerate, simple things like healing and regenerating new skin after we maybe have cut ourselves by accident. So when I found out that they're essentially signaling peptides, the LifeWave patches are signaling peptides, which I was already implementing and figuring out how I could use it for patients, there's a little light bulb went off. Why? Well, peptides require more injections or IVs. Once again, more people, they don't want to do that. So I'm always looking for methods that are simpler, more efficient, and more effective. Okay, so hey, this is an idea. I can take a patch and I can put it on someone's skin and I can leave it there for 12 hours and they can repeatedly do that day after day. And I had to look at that as a comparison. If a person goes for an injection of a peptide, they may only go once in a month, once every 6 months. So in our bodies, we make the best and biggest changes by frequency, intensity, and duration. We see the similar things occur for people when they play sports. It's basketball, football, swimming. If they're practicing and they're doing repetition and they're doing specific kinds of training of intensity, their body, their anatomy, their physiology changes and adapts. So, LifeWave patches give us that ability to do that. We don't have to go to the doctor 5 days a week, 6 days a week. We can do it at home and on our own schedule, and our body is getting signaled. A signal is occurring, and our body is doing the rest.